Welcome to part 8 of training muscle lengths, chest. When we say chest, what you're probably thinking is the pecs and specifically the pectoralis major. That's this big ol' muscle up here. You've probably heard people talk about the upper chest or the lower chest before. That's because the pec major has multiple heads. They all end up inserting into the humerus over here, but the clavicular head, as you can see, originates from the clavicle. And the sternal or sternocostal head, sometimes you'll hear those used interchangeably, which we can see originates on the sternum and actually the second through the sixth ribs. Sometimes you'll have this lower portion described as something like the abdominal head. That's because it does have some interactions with the external oblique, but the general consensus is we treat this as a two-head muscle, the clavicular and the sternal. We have two more muscles of interest here, the pec minor, which is underneath the pectoralis major, and the serratus anterior. You'll hear serratus and serratus used interchangeably. Which one is technically right? Tomatoes, tomatoes. Who cares? Both muscles originate on the ribs, as you can see here, and they both insert into different parts of the scapula. A major function of the pec minor is to stabilize the shoulder girdle, and both the pec minor and the serratus anterior function to protract the scap. If you remember, protraction is spreading those shoulder blades apart like you're giving someone a big ol' hug. You'll often hear the serratus described as the boxer's muscle. That's because punching involves protraction of that scapula, and so a good boxer will typically have a highly developed serratus. So if the pec minor and the serratus anterior both function to protract the scapula, then you can guess that a fully retracted scapula, like in the bottom of a deficit push-up, is going to be their fully lengthened position. And near its full length at the top, especially if you protract those scaps, like you're pushing the ground away, and perhaps even a shorter position on some sort of a press around, like this clavicular press, which we'll talk about in a second. Now on the pec major, look at the general direction that these fibers are running. You've probably seen people talk about having your arms sort of out at a 45-degree angle. That's to keep the force of the press in line with the musculature itself. Both heads of the pec cause shoulder flexion as well as horizontal adduction. Shoulder flexion is like a front delt raise. Horizontal adduction is like a fly. So if we have that shoulder joint extended and horizontally abducted, we'll be putting the pec major into its lengthened position. And with the shoulder flexed and horizontally adducted, we're in its short position. Now, of course, there's not much load on the pec at the top of a press like this because the load is effectively directly over the joint. So that's where movements like cable flies come into the picture to actually create tension on the pec in its shortened position. Now, the two heads of the pec can't separately contract, but because they do have completely separate origins, we can potentially put more stress on the clavicular head by using some sort of an incline press or fly or press around like this. Comment what muscles you want to learn about and follow to learn more about training science.